Hello, Dr. Dervis. Thank you for being here today. I know that you're super busy, but I appreciate your time.
Thanks for having me. Glad to be here.
Of course. Thank you. So I was wondering if for the beginning you can just introduce yourself to us, tell us a little about your background.
Sure. My name is Dr. Sean Davis. I am a distinguished professor of marriage and family therapy at Alliant International University, where I've spent most of my career. I've been here for about 18 years, I believe. I also own a group practice in California with offices throughout California, the Davis Group Counseling and Wellness Services. And I split my time roughly 50-50 between those two things these days.
Mm-hmm. Yeah, and you have so many cool services at your private practice, so that's awesome.
Thanks.
So I know that most of the people, they know you from your research and your background about common factors. So I was wondering if you can talk about your primary focus of your research on common factors and anything that, how did the whole journey start for you?
Sure. It's evolved a lot over the years, so I'll speak to mostly where it is today. But how it started for me, common factors, was when I was a master's student many years ago, learning the different theories. And at first I thought, wait, all of these theories sound like they're just using different words to describe the same thing. The more I learned them, the more I dove in. So I initially got into common factors that way through kind of theoretically looking at that. And then the more I dove into it, I looked into it from the other angle as well, the sort of broader aspect in terms of alliance. Like essentially this question of when someone walks in the room, individual, couple, family, whatever, and they sit down, and then when treatment concludes, they've gotten better, what happened in that room that helped them get better? Because there's a huge variation of what happens across different therapists around the world. But regardless of that, people are still getting better. And so what is it about this work that we do that is healing? Really is essentially what it boils down to. And are there ways we can maximize the effects of that? Are there ways we can train that, teach that, etc.? That was a question that, to me, back then, surprisingly, not many people were asking. They assumed they already knew the answer, like it's our theory or whatever, and so then they would just test that.
That's very interesting and very true. So when you look back, how do you see your research being changed, or how has it been evolved during the past years in your experience about common factors?
For me, it started off with looking at sort of the main common factors such as the therapeutic alliance, hope, expectancy, extra therapeutic factors, those types of things that largely were attributed to Michael Lambert a long time ago. Doug Sprinkle added some systemic ones. But to me, it all goes back to that question of, okay, but really what's going on in the room? Because even some of those early lists, while they were helpful, to me, I thought they still are also sort of broad, and they don't really get at the answer of that question of what's happening in the room that makes therapy healing. So for me, the way it has evolved is I have started looking outside of therapy at more sort of indigenous healing practices. So cultures that involve don't use therapy as a means of coping with their problems. What do they do? And so for me, the broader I've expanded my focus, the more I have thought it really just comes down to the therapist. So much of it is the therapist's deep, sincere, true caring about the client in front of them, and sort of a deep witnessing of that client, holding that person in such a way that they are sort of equally as important to them as the therapist, like their needs, their beliefs, their values, opinions, life, etc., is every bit as real to the client as the therapist is to the therapist. So the more therapists are like that, the more effective they are, I think. And so a lot of my research has shifted that way, away from kind of techniques, away from the dynamics that are happening in the room, towards who is the therapist as a person, how does the therapist value people, and how good are they at holding that space.
And I know that you always talk about being versus like doing, as a therapist, or being a therapist, and I think that that makes a lot of sense. I think I know somehow the answer to this question, but still I'm going to ask it for our audience. That how do you think common factors shape your research and clinical practice?
Yeah, they give me permission to ask big questions primarily. And so I think they free me up from feeling like I have to know the answer or to prove something. They free me up from thinking, okay, this is the theory I need to go try to prove. This is the approach I need to find support for. It really is much broader than that. It's simply what's going on here, you know? And to me, that the way it informs it is it just gives me much more permission to ask broader questions and to stray outside of the traditional scope of traditional research. So how does it inform my clinical practice? I would say it also gives me a lot more freedom there in terms of I think I need to tailor my approach to the client rather than tailor the client to my approach. So if I am such that I think there is an empirically validated way of working, right? Or there's a way of, my theory is better than everyone else's, then I have to sort of contort my clients to fit that theory, which some just simply don't. And so in that case, what do I do? But to me, common factors gives me the freedom to adapt my approach to the client instead. So I still start off with the approach that I like. And if it seems to just not be working, I understand, I know the other theories well enough to know that there are 3 or 4 other theories that focus on essentially the same process, but with different words, different interventions, a different sort of vibe to it. And so I just can use one of those until I find something that resonates.
And I think that hearing that is very kind of like relieving as a therapist, as an educator, for me at least. So in doing all of that in your clinical practice and also in the many different research studies that you had, have you faced any sort of challenge challenges with common factors, or applying them or studying them or anything like that in your experience?
Well, it is not something that is easy to get funding for. In the early days, common factors were not even viewed as a legitimate line of inquiry. There was a lot of pushback against them. They were viewed as being sort of too vague or broad to be useful. That has changed a lot with time. That's been one big shift. Is now they're much more mainstream. You don't often find people saying, no, common factors have nothing to do with the work I do. Yeah.
What about teaching? Like I'm just curious as a teacher myself, like when you teach that to your students or working with supervisees, sometimes this is my impression, that sometimes when we talk to supervisors or students, I feel like something is more like is easier for them or more tangible, like for example CBT, and they choose that and they are very biased about that, and sometimes you feel like it's not because this is their favorite theory or it's the best fit for them. It's just because it's more tangible, easier to digest. Have you faced any sort of those challenges with students or supervisees in using common factors?
Yes. And I should clarify, I don't think of common factors as a new theory per se. I think of it as a way of thinking about existing theories more so. And so in that case, what I would say, yes, I do see that. I would encourage the conversation I have with therapists in the early stages is to help them realize that honestly, even if you fast forward their career 20 years from now, the things that will make them therapeutic then are already in them right now. Like they don't need to learn them or hone them or master them. They just need to allow them to emerge, meaning the ability to sort of see other people as people, the ability to just sort of sit and be present and listen and hear and validate. All of those things are, the old adage that people don't remember what you know, they remember how you made them feel. That's the healing piece. So if people can feel seen and heard and understood while they're with you, you are already way ahead of the game. And then yes, you do need to know intervention. You do need to know practical solutions for their problems that you can help them with. That's where the theories come in. But don't get so wedded to a particular theory that it becomes gospel to you. Or realize that you're doing it for you rather than them. So like an anxious therapist who loves CBT, well, you love it because it's concrete, right? And it alleviates your anxiety. It may have, which has nothing to do with your clients.
Yes.
So, just accept that, be aware of that, and be aware that that comes with limitations. And so the goal then is to just sort of trust and relax and ease into something that is a little bit more your natural presentation, which may end up being CBT, which is fine. But you do it from a place of kind of natural emergence rather than anxious grasping.
That makes a lot of sense. And I think I have so many comments and questions about that, but that would take another 2 hours. So let's go back to our focus on research and research studies. So what would you say to our audience if they were doctoral students or junior scholars, usually in the beginning, just doing a research study, designing a study, conducting a study seems very scary for people, let alone publishing or submitting your paper to a journal. So what is your advice as a mentor to them? How can they start from your perspective, like small steps, so that it would be less scary for them?
Yeah, I would say, first of all, come up with a question that is personally interesting to you. You're going to have a lot of pressure coming from outside. Hurry up and finish this dissertation or study this thing that your chair, your mentor wants you to study, whatever. Try to clear all of that noise and ask a question that is really interesting to you personally. And don't get hung up into how I'm going to ask it. I see this all the time. Students will, well, this is interesting, but I have no clue how I'm going to answer it. So I won't even do that. I'm like, no. We'll figure that out. Every question can be answered empirically. So find one that is interesting to you. Then once you've found one that's interesting, honestly, the nice thing about science is it is fairly kind of lockstep, right? Like you just sort of follow the recipe for empirical research, whatever that is. You don't let the tail wag the dog, so you never let the method guide the question. So you just find a method that fits the question rather than vice versa. and just go for it. Divide it into small chunks. Don't think of it as like I tell students, think of your dissertation as 4 separate term papers. Don't think of it as one gigantic project.
Exactly. Yeah.
So, yeah.
Mhm. Thank you so much for sharing that. Yeah, it makes a lot of sense. And I think one of the things that I experience with the students, and when I was a student, is like when they look at a research study or conducting a research study dissertation, sometimes people feel like they need to be the expert in everything, right? I need to be the expert in the literature of this topic. I need to be the expert in the methodology. I need to be expert like in everything. My writing should be like amazing. And I think, yes, you should have skills in all those different areas. And at the same time, it is really important to think about collaboration and networking, because a lot of times it's a like team project, it's a teamwork, you can always ask out for help, stuff like that. What is your comment or feedback about that part about collaboration and networking?
Yes, it's crucial. You will be a lot more successful if you join a team of like-minded folks. To the idea of basically kind of imposter syndrome that you're talking about, or like, okay, this is there are so many experts out there, and here's little old me. When I graduated, one of my professors told me, he said, you will never know more about this field than you do right now. Like when you finish your PhD, your head is full of more information than it ever will be at any point in the future. And I thought, that's ridiculous. There's no way that's true. You all know so much more than I do. You were the ones teaching me. But I will say I very much see what he meant. I know a lot more about a handful of different things, like than I did back then. But I've also forgotten a lot about a lot of things. And so don't shoot yourself short. If you have worked hard in your program and taken your studies seriously, you deserve a seat at the table along with anyone else.
Yeah, exactly. And I think a lot of times people, they are scared of rejections, like either like a rejection of idea or even like a submission in a journal, and they get rejected. And I always tell them it's very normal. It happens to the best of best, and it will happen to you. And yeah, so you get rejection, and then you work on it, and and submit somewhere else.
Yes.
If you keep like just thinking about it and being scared of rejection, you won't get anywhere.
Yeah, exactly. And that's also where having a team comes in handy, because almost for sure someone on the team will have been down this road a lot and have words of wisdom about the process. And because publishing is every bit as much of a game as anything else. It's not just simply if this article is great, it will get published. It's also about how do you sort of navigate the process of shepherding it through to publication. There are ways to do that hurt and help your chances.
Exactly, yeah. And networking always. I'm a huge fan of collaboration.
Yes.
So I asked different questions that I had. I guess like one of the last questions that I have is, I'm just curious about your perspective on the future of common factors research. Do you see any new topics, areas, or things that you see in the recent studies?
Yeah, people are starting to talk more about a therapist's way of being, like I was mentioning earlier. People are also starting to talk about principles of change rather than theories, which I think is a very fascinating direction to take things. Sort of like, okay, what are statements of principle that capture the essence of what a lot of different theories are trying to do? And so a way of condensing them into more succinct statements applicable across a wide variety of circumstances. I still think it is you know, I've always wanted to do this, and my energy for it ebbs and flows. But I think some type of um, circling back to what got me interested in this to begin with is like all these theories are talking about the same thing. I would love to see some sort of like chart or something that listed, here's all these theoretical concepts. They're all talking about this, you know. I think that would be super interesting. So if any of your readers, publishers want to do that, I will cheer you on.
Yeah, that sounds great. One of my critics about all these different theories, and I appreciate all of them. I appreciate the pioneers, but I think that sometimes it like they got into a business instead of like learning
Yes.
process. And I understand we live in a society, we need money, we all pay bills. But at the same time, like there's this question in mind that, okay, you need to do, all these different levels for XYZ theory and then pay all this much money. And then there's this other one and this one for this population, this one. So like it's very sometimes confusing, especially like if you're in the beginning of the journey. And sometimes people like they're too excited, they want to do everything and spend all this money. So I think as a system, maybe we could do better in terms of like addressing those concerns. But I don't know. At the same time, we are living in capitalism.
No, I agree with you 100%. I think as soon as someone's ideas become proprietary and their way of making a living, their their scientific kind of objectivity is compromised. They are, of course, very much invested in proving that this is true, which is, as we all know, not the way to start a good, honest scientific inquiry. And it also affects the way it's taught as well. Like I remember myself when I was younger, a newer therapist, and I see it in my students now. They'll go to a training on whatever model of the hour, and they will come back. They'll go really excited, and they'll come back honestly a little bit discouraged because their feeling is, if I'm not doing this, I'm really doing subpar work. Because they convinced me that this is the only thing out there that is worth doing, and I'm not that great at it, or I will be, but I have to pay, $8,000 and another 2 years of my life. So I just don't think that's true. I know that's not true. The research doesn't support that all the certifications really matter. The common factors, again, the things that will make you effective, no matter which theory you're using, already are in you.
Yeah. Sometimes I wish, like, how in research papers we have the limitation part. I know that the like theories or the pioneers, sometimes they also talk about the limitation of their theories, but I feel like it's not authentic sometimes. I wish like, instead of like telling people, hey, this is like the magic ball that I have and it will like solve everything, every problem for everyone. I say, hey, these are the tools that are helpful, and here, like they have limitation. But that would never happen.
It would be nice. Yeah, just saying, hey, here's how I like to work. See what you guys think. If you want to do it, go ahead. If not, that's fine too.
Exactly. Yeah.
Yeah.
So, Dr. Davis, I guess like my last question is more personal. So I know that you have different roles. You are a therapist, you're an educator, you're a researcher, clinician. Do you have a favorite role?
Oh boy. Ooh. Yeah, the thread that runs through all of those that I like the most is the mentorship. I I was quite fortunate to receive very high quality mentorship during my grad school, better than I think I felt like I deserved, certainly. And so I love paying that forward. To me, that's the piece that I love. And I will devote energy to each of those things you mentioned based on which one at the time is allowing me to the most mentorship opportunities. So I don't have one that I like more than others. I like the one that helps me mentor people the most.
You don't have a favorite child. I got it.
No, but they do have to be behaving for me to like them.
So what has been the most rewarding aspect of your career so far?
That I would say the mentoring, in particular, I came from a very, you wouldn't know it from looking at a white guy, but in other aspects, an underserved and underprivileged background, and was someone helped open doors for me that I would not have been able to open myself, and they helped me see things in me that I would not have seen myself without their help. And so I very much enjoy that, especially is, if I see a student or a colleague or someone who comes from a similar background and is also talented, but doesn't quite see it, I really enjoy helping them discover it and kind of clearing the path so they can step into that space, and then, setting them loose to go do their thing in the world. That to me is extremely, there's nothing better than that.
That is very rewarding. And I'm very proud that I can call you my colleague. So
Thank you.
It's really a great experience. So
Thank you.
Thank you. Thank you so much for your time. Is there any last word or last thing that you want to say?
No, I would say just stay curious to everyone. Ask your own questions, make your research interesting to you, and do that, and it will be useful work. So yeah.
Sure. Thank you so much, Dr. Davis, for sharing your wisdom with us and for your time.
You're welcome. Thanks for having me.